First of all, I'd just like to acknowledge that I'm on the lands of the Whadjuk people of the Noongar Nation. I acknowledge and celebrate the continuing traditions, living culture and the spiritual connections the Whadjuk people have to Boorloo and the Derbarl Yerrigan. I also acknowledge any other First Nations Australian people that are present here today and celebrate and recognise the elders past, present and the leaders emerging. All right. So today I'm going to present some of the considerations for particularly Aboriginal HRECs when looking at Indigenous genomics research studies. So we've actually been talking to Ardeen and her team. I'll also provide a bit of context for the work that our team's doing. So for those that aren't aware, so genomics is the study of organisms' genome, its genetic materials, and how this information is applied. So it's really broad research and information. The nature of genomics research, including the use and analysis of previously collected data, means that there's some really specific considerations for First Nations Australians. And the technical advancement means that genome-wide association studies exploring the effectiveness of things like pharmaceuticals and precision medicine require large data sets. So genetics and genomic science research has been really rapidly increasing. While the human genome has been mapped, the full extent of the diversity of the world's population is yet to be identified, and the application of these data for genome-wide association studies highlight the absence of minority populations, which raises several considerations, especially when the potential benefits for improved health outcomes are considered. So you can see here, as of last year, 86% of the genetic sources which are used in these studies were primarily for people of European ancestry. So, and this also has impacts directly on the use of health benefits because the health benefits genomics research exists primarily for a European white populations. The diversity of genomic data reduces bias in predicting disease risk and treatments. So therefore, the team at the Australian Alliance for Indigenous Genomics received an MRFF grant to actually help to progress and build a pathway of benefit for Indigenous Australians in genomics research. And so to do that, so in doing that, we are working to build and extend Indigenous leadership in genomic science, research, precision medicine, data sciences, and ethics to increase participation in genomics, deliver the benefit from this application, and ultimately reduce the inequalities for First Nations Australians. So as a line, as we're known, we have 6 core purposes. One is to establish an Indigenous genomics network, including leadership, coordination, and alignment of expertise. And in that, we have about 45 key investigators who have stepped up originally to at the start to contribute to this work. And that's managed across 6 nodes nationally. So the other one is to build a pathway to benefit. So we are looking at defining and planning and implementing a pathway to benefit for Indigenous Australians, build the capacity of genomics in Indigenous genomics research from a clinical and research workforce perspective, as well as a community perspective. So we're looking at from all different perspectives, including, and in that we're developing and enhancing Indigenous community understanding, involvement and leadership through quite a significant large Indigenous evidence structure. We're identifying and developing and communicating critical genomics policies, so contributing to policy at a national as well as a local level, and looking at and defining and share and support the implementation of culturally appropriate and ethical data and sample storage and navigating what that looks like. So as we develop and support this work nationally, we are already being approached by the Aboriginal HRECs for training and guidance around genomics and how to actually approach the research. And so we've identified in the process of this, sort of identified at the moment some factors that we think should be considered if you're looking at Indigenous genomics research. So at this stage, we see looking at think 3 key areas around strength-based research, Indigenous data sovereignty, and consent. So why is strength-based research important? Well, to date, genomics has often demonstrated some ethnocentric, European-centric biases and fails at the moment to represent diversity in its data sets and its workforce. And so it's more likely to exacerbate and mitigate existing health inequalities. Decisions about which questions are asked, how the findings are interpreted and communicated, these all carry significant risks for peoples and communities from which the data is originated. In common with other research, when genomics research has been undertaken on Indigenous communities by some non-Indigenous researchers, the work has sometimes failed to address the community priorities or been overwhelmingly framed in terms of a deficit or dysfunction. So, and often genomics has historically used racial categories in ways that have potential to undermine the rights of Indigenous people into self-identification and direct attention onto the role of genetics in disease to the detriment of our known social and environmental determinants. So some of these risks are significant. One example of this was the interpretation, the claims of a warrior gene being an explanation for violence and addiction in Maori populations, and completely ignoring the complexities around this. This hypothesis theory was picked up and, to some extent, twisted by the Australian and New Zealand media. And while this is extreme, it's understandable that First Nations Australian communities are understandably cautious. So using questions that don't necessarily align with our community interests can also risk undermining cultural histories and beliefs, and may undermine claims to land and resources based on identity. But to be excluded from research brings its own sets of harms, especially when it's imposed by others rather than the result of a community choice. So HRECs need to be careful when making decisions about genome research with with Aboriginal and Torres Strait Islander communities, that in the process don't inadvertently replace one set of harms with another. And there's a need for Aboriginal HRECs to ensure that we don't make decisions on behalf of the communities, but rather use the role to ask the right questions of researchers and encourage good research practices. So Indigenous data sovereignty, I'm sure many of you are hearing about this. So what is it? Well, according to the United Nations Article 31, there's a recognition internationally that Indigenous peoples have the right to maintain, control, protect, develop their cultural heritage, additional knowledge and traditional cultural expressions, as well as a manifestation of their sciences, technologies and cultures, this includes human and genetic resources, seeds, medicines, knowledge of the properties of fauna and flora, oral traditions, literatures, design, sports, traditional games, and visual and performing arts. We also have the right to maintain, control, and protect and develop intellectual property over such cultural heritage, traditional knowledges, and traditional cultural expressions. So this has resulted in an international movement towards Indigenous data sovereignty. So Indigenous data sovereignty provides principles that articulate the rights of Indigenous people across their information and data. These principles emphasise control, autonomy, and self-determination of Indigenous communities in the collection, management, and use of the data that pertains to them. In Australia, the Miramna Wangara group have identified 5 key principles for Indigenous data sovereignty in Australia, and this includes that Indigenous peoples have the rights to exercise control over the data ecosystems, that we have the right to data that is contextualised and aggregated, and that's accessible, that the data is relevant and empowers and sustainable self-determination, that we have the right to data that structures that are accountable to us, and we have the right to data that is protective and respects our individual and collective interests. So what is it? Operationalising Indigenous data sovereignty requires identifying the factors that influence the way in which it's conceptualised. These show multiple levels. This image shows multiple levels that can be action. And Aboriginal HRECs play a really important role in driving the operationalisation of Indigenous data sovereignty principles in genetic research. And this can include identifying factors that may be contextual across the program of work, such as dynamic consent models, continuous community involvement, and support for data access from for community benefit. And this should be done alongside the emerging frameworks and guidelines that are being developed in this sector. So, and then finally, consent in genomics research is complex. However, First Nations Australians, there are some additional considerations, especially when the research includes genetic testing. A core facet for ethical research ensuring informed consent, and it's particularly important how genetic and genomic research, as there's a number of considerations that should be communicated to participants to ensure they are fully informed of informed prior and consenting in a way that's clear. So to describe this as a need to build genetic health literacy, both can be simplistic and paternalistic, as the construct denies the recognition and incorporation of our rich ancestral gifted knowledges, family and community structures, cultural obligations, and the priorities of Aboriginal and Torres Strait Islander peoples, all of which need to be considered and integrated into the genetic health materials and the consent process. And this would not only better inform Indigenous patients and families, but non-Indigenous health clinicians and researchers. For most of the people involved, this will be sometimes the first time they've actually received such a detailed consent form for consideration, and the clinical environment during which can be a really stressful time. So the expectation that a person or family could provide free and prior informed consent is not always reasonable and could almost fall short of our national human research ethics standards and expectations. And some of the evaluations and studies into consent processes internationally and in Australia have highlighted the importance of trust. So trust in the process, the researchers and the clinician. I think, and when we're looking at looking at genetics work, research, we also need to be considering that participation is not just the participation of the individual, it's also their family members. And that, again, is recognising the importance of cultural considerations in this, including the family structures and our priorities. And with that, the management and return possibly of, or disposal or treatment of samples. So I am going to finish up. So thank you. For us, the take-home messages are that First Nations Australians have experienced some significant harms from research. We need to be included to benefit from the scientific benefits, and that the Aboriginal HRECs can play a really important role in the operationalisation of all of this. We've actually been speaking to our dean and the team, and our next steps are to work with those Aboriginal HRECs who have approached us to develop processes to support them. So thank you, and this is the Alliance website.